Hello, my name is Carmen Chalupiak, and welcome to my final module assignment for LIFT 1006 Curriculum and Instruction for November 3rd, 2023. The course I am working in is called CNUR 303 Theory and Practice Education for Families and Newborn Partnerships. It is a third-year course from the Bachelor of Science in Nursing degree program offered here at Sask Polytech. The course is 3 credit units that integrates theory in the classroom setting with a practical placement in the mother baby or labor and birth unit. My first learning objective that I have identified is to integrate previously and concurrently acquired knowledge, skills, and abilities in practice. This learning outcome uses the word integrate as the action verb, which comes from the psychomotor domain at the level of problem solving. This is an appropriate level of expectation for a third-year nursing student. This allows for students to adapt existing skills they have and apply them in different contexts. Students at this point of the program possess the foundational knowledge required to consider nursing within the specialized context of families and newborn care. My second learning objective is for the student to advocate for patient and family-centered care to promote health and social justice. This uses the verb advocate, which comes from the affective domain at the level of characterization, which allows the students to articulate their own values and belief systems. Evidence of this learning outcome occurs through journaling that the students engage in weekly with frequent feedback from their instructors. To help students achieve the learning objective of this course, I have selected 2 instructional strategies. The first strategy is high fidelity simulation. This fits into the experiential learning category because it is learner focused and activity orientated. We have an amazing simulation unit at Sask Poly. This fits into my learning outcome number 1. The course purpose is on the focused population of pregnancy and newborn care. This is the student's first opportunity with working with this specialized group of patients. The students have 2 high-fidelity opportunities based on a normal vaginal delivery and a postpartum hemorrhage. They need to rely on the skills and knowledge they have from previously acquired classes and apply it to pregnancy and newborns. A scaffolding approach is used. The second instructional activity I will use is weekly reflective journals, which taps into the independent study category. The learner provides weekly self-reflections on what occurred in the clinical area. There is a shared document between the faculty member and the student, and in that document is a category that focuses on advocacy. Students are to provide examples of how they advocated for safe, competent, compassionate, and ethical care for the patient and their families. So I really enjoyed step 5 of this module that focused on reflective practice. I love the quote that was shared, so I wanted to include it in this presentation. It is a good reminder for me to be reflective and intentional in that reflection process. Currently, I think I do a good job of being reflective. I always take a few notes immediately after a class or a seminar on things that worked well and things that I could do differently next time. I really enjoyed the How to Become a Reflective Teacher guide as well. That was shared in 5.7. I think I will try to incorporate using exit slips more often to get a better understanding of where my students are at. So some key takeaways for me include I feel like I have a really good understanding of how to develop learning outcomes. I appreciated all the learning materials that were available to print off to use for the future, like the verb taxonomy list. And finally, I really enjoyed engaging with other faculty members from other areas of expertise rather than just from nursing. So thank you for your guidance through this module, and I look forward to the next one. So long.